Welcome to Legal Keys, unlocking time, revenue, and results. The podcast that connects you with the people, technologies, and trending topics shaping the modern legal landscape. From cutting-edge AI innovations to high-growth marketing strategies and everything in between. Legal Keys is your go-to resource for actionable insights. Brought to you by Faster Outcomes and hosted by Tim Sawyer, two-time Inc. 500 co-founder entrepreneur. We're here to help you navigate the tools and trends driving success in today's legal world.
Hello, welcome to Legal Keys, actually episode 19 of Legal Keys. I'm so excited today to introduce our guest, but before I do that, I want to thank our sponsor, Faster Outcomes. Faster Outcomes offers the ultimate AI legal intelligence platform for lawyers and law firms of all shapes and sizes, and soon, spoiler alert, healthcare, which is perfect timing for the guest that we have today. If this is your first time listening, you picked the right day. Been supporting us for a while. We appreciate your continued support. And as always, please share and like. We're so grateful. With that said, I want to introduce a really cool guy. He and I have a lot in common. Dr. Joe Esposito, or Dr. Joe, as he's known, is a nationally recognized chiropractor, clinical nutrition expert, and award-winning healthcare provider with over 40 years transforming how clinics deliver care and measure success. He's a diplomat of the American Board of Chiropractic Orthopedics, the Chiropractic Board of Clinical Nutrition, the American Academy of Pain Management, and the College of Clinical Nutrition. Dr. Joe's career reflects a rare blend of science, so we're going to get into that, clarity, and compassion. He's a functional medicine expert, and I can't wait to hear from him. Dr. Joe, welcome to Legal Keys.
Well, thank you so much. Who wrote that introduction? That was very well done.
I appreciate you coming. And it's super timely. As I mentioned, we're getting ready to launch a healthcare division. And one of the things that I want to talk about today is as we travel the country, we go to a lot of different conferences, and particularly on the personal injury side and in family law, we bump into a lot of folks that there's an intersection between healthcare and legal, right? In PI, you've got the neurologists who are doing expert witness testimony and helping determine diminished capacity. In family health, you've got psychiatrists and psychologists that are doing a good job evaluating the mental health of the children involved in the case, and so many other cases in between. It's timely that you're here. So tell us a little bit about the work that you're doing. Start with, let's talk about traumatic brain injury, right? That's a fairly common problem that needs to be solved. First of all, evaluated, and then you have a unique way of actually treating that. Talk a little bit about that.
Yeah, I just spoke at the Southeastern Neurotrauma Conference, and it was great. So it was chiropractors, medical doctors, orthos, neuros, everybody was there, lawyers. It was a great group. And what I'm seeing in the field is people can diagnose the heck out of a traumatic brain injury. We can do online diagnostics with a neurologist, and they can say, yes, Joe Esposito was in a car accident. He's got a traumatic brain injury. Let's present this as part of the legal documentation to settle the case. My statement to the doctors was, what do we do about it? What do we do about this TBI? We can diagnose the heck out of it. We can tell them you're going to have loss of sexual function. You're going to have trouble walking. You may not be able to work. You may not be able to go back to the job you had. But what protocols are in place to actually treat the patient? Right. And that's where the biochemistry and nutrition comes in. And I went off on a tangent. I won't give you the whole seminar I did. But when a brain is injured, it releases something called glutamic acid. And glutamic acid causes an inflammatory reaction and causes pain. So if I have somebody with TBI, and I've completed the TBI training course too, and we give them Chinese food. Chinese food loaded with monosodium glutamate blows up their brain. Doc, my headaches are getting so much worse. I'm eating these packaged chips every day. Autolyzed yeast, hydrolyzed vegetable protein. There's 40 different names, essentially, for monosodium glutamate. You're giving somebody glutamic acid, not a good idea. Okay? So that's an issue. Aspartic acid, same thing. Artificial sweetener. We give somebody diet soda because they're trying to lose weight, because they've been injured, they can't get up and move around, they're gaining weight, I want to lose weight, I'm drinking diet soda all day. Aspartic acid acts like glutamic acid. It's an excitotoxin to the brain. And the patient isn't getting any better. and they do the nutritional analysis. The psychological analysis. Well, you know what? Tim is still having these problems, and we're going to recommend that he not work anymore. We're going to recommend permanent disability. Tim doesn't want permanent disability. Tim wants to go back to his life. And so that's what I think is one of the missing links in TBI is we set up a nutritional protocol. And that's something that's really important that I don't know anybody else is doing it, which is kind of exciting. So I kind of cornered the market on it. But TBIs are huge, and it's great to diagnose for the legal aspect. But now we have to put together a protocol specifically for that TBI patient.
So one of the things that, as it relates to TBI, and I don't want to make this all about TBI because I'm really interested in the nutrition piece. One of the things that I've discovered in working, particularly with personal injury lawyers, is that there's this huge, I don't want to call it a gap, chasm, if you will, in between, you know, if you look at settlement data, there's certain lawyers that are just killing the numbers in terms of the settlements they get for their patients and obviously the contingency fees that they get, right? Because they're getting higher settlements. And what's interesting is those lawyers, when you talk to those lawyers, they could probably hold their own, certainly not be an expert, but hold their own with a conversation around chiropractic care and traumatic brain injury as it relates to diminished capacity, right? They understand the implications. But to your point, I don't think a lot of them would know much about, okay, this impacts the settlement, but how does a person get better? So how are you getting the message out? And it would seem to me that lawyers would be a great place to start, right? Listen, because to your point, and a good lawyer will tell you, they want to return the person to who they were before the accident. It's not just about the money. Like you said, they want their life back, right? So what type of outreach are you doing now? And what's kind of the cheat sheet that a personal injury lawyer should be thinking about when helping them find post-care?
Well, one of the things you have to look at, and we talked about AI, and I could go off on AI and how AI is going to change the PI world forever.
We'll get there.
Because there's so many, we'll get there with doctors doing unnecessary surgeries and claiming that there was a case and there was no ruptured disc. And so AI is starting to read these MRIs now and say, wait a minute, this MRI says the person was clear. Why'd you fuse five segments of their spine? So anyway, I'm excited for AI to clean up the industry because the industry is very dirty. There's a lot of folks out there scamming, and it breaks my heart because those patients aren't getting the care they need. So I go out and meet with attorneys 2 or 3 times a week. I host a radio show. I'll have them in the studio in the radio. I can't have them as a guest on the show, but I can have them in the studio as a show. I'll take them out to lunch. They'll take me out to lunch. I had one attorney stop in today. I wasn't here, unfortunately, at my office. Hey, I want to get together with you. You have a great reputation. Because the insurance companies know who the scammers are and who they aren't. And you said something that was very profound. There are some attorneys that get great settlements. Why? The insurance companies know that these guys aren't going to settle for pennies on the dollar. So many attorneys, a lot of these big advertisers, unfortunately, not all of them, there's some good ones out there, they'll settle for pennies on the dollar. They'll take the second offer and close the case.
Right.
Well, then they'll pay the patient and not the doctor, and they get a bad reputation. The insurance companies know who these are. I know who the doctors are. Which doctor is going to take 10 cents on a dollar? Right. So if you want to work in that field, you're going to do a lot of work for very little return. And if you get caught, which you will, you could lose your license. Then there's the good attorneys who work with the good doctors and say, listen, Joe, we're going to send you a TBI case. We want to make sure we get the MRI, make sure we get the evaluation, and then I want you to put together a protocol. So when we go to court, we can say there's going to be like a life care plan. There's going to be continued need for Tim to take a magnesium supplement to help reduce the glutamic acid that's always going to be released from this traumatic brain injury. And we're going to add that into the specials we call it. They do the specials and then they do future care. An attorney who's not doing future care is not getting the best settlements and then not treating the client the way they should. You have to say, all right, Tim had $5,000 in bills, but Tim is going to need ongoing care forever. And this is our projected future care in a big case, a life care plan, to put it together to say this is what we're going to need. And so that's where you have to work with good doctors and good lawyers. And that's why I try to meet the good ones. And everybody knows everybody. It's a very incestuous crowd we run in. So when you find out who the scammers are, I'm done. I don't take cases from this guy anymore anyway. So, and I do that with not a lot of attorneys, but a few. So.
Yeah, and it's like I said, it's interesting too, because as we travel the country, meeting neurologists and
Yes.
neurologists will look at our AI platform. Let's talk a little bit about AI and say, so let's say they're doing expert witness testimony, right? And they get a case and they can use the AI to, they create a pretty quickly get to a medical chronology that makes sense.
Right.
And then they can chat with those documents. So is there any evidence of it? Literally, you could start to build the case inside the chat platform. And because it's encrypted, HIPAA compliant with the SOC 2 type 2 level encryption, you can put anything into the platform. So more and more healthcare folks are discovering how they can use AI. Personal injury have figured it out, right? And the reason personal injury figured it out is because it's an aid to them to help them better understand the medicals, right? Because they can chat with, because now you've got the best medical assistant with the right data sets that tell them, hey, this is, and so what are you seeing in your field in terms of artificial intelligence? Some of the use cases that you're seeing, and is it to go faster, get better analytics? What's going on?
I use it on a regular basis to research. Patient has this, and this. What's going to be the best protocol? And then I take my knowledge and say, well, AI lies, by the way. AI isn't always right. Okay. So you got to make sure you have knowledge. You can't just rely on AI. I know a couple of attorneys got in trouble because they were writing up their briefs with AI, and the judge spotted it as AI and went, wait a minute, this isn't right. And it was wrong. They just assumed AI was right. So we got to be careful with that. AI is great in the healthcare field because we can plug in different things and say, okay, help me with the diagnosis. Because AI is actually better. I saw a study they did. They had a tough diagnosis. I think it was 100, 110 cases, and it was obscure symptoms.
Yep.
And I don't quote me on the exact numbers, but I think 25% of the doctors got it right. 50% of the doctors with AI got it right. AI by itself got it right 80%, 85% of the time. So it can work better than our brains can. Yeah. So we use it to come up and say, okay, this person has this, and this. What's going to be the protocol? And do we need a referral? Because we're looking at long-term damage as well. Do we want to co-manage the case? Is it a chiropractic case? Is it an orthopedics case? Pain management case? Psychological case? And so we want to manage the case that way as well. So that's where we're using it. But I think once we start entering all the doctor records, and this is where I see AI becoming so helpful. You have my records. You have the orthopedist, neurologist, neurosurgeon. Put all the records together and say, okay, AI, what are we seeing as a pattern? Do we see that this may be permanent impairment? Is there a disability involved? This person is a piano player. Yeah. Well, they broke a toe. Well, that's probably not going to be a big issue. Not a big impairment because they can still play piano. Somebody loses their hand and they're a field goal kicker. Not a big impairment, but a big disability. And so you have to understand the difference between disability and impairment, and AI can come up with that and say, here's your disability, here's your impairment.
That's an interesting. Someone once said to me, we were talking about when you have an impact on mental capacity, diminished capacity, right?
Yes.
And he said, hey, just because take Albert Einstein, he's got an IQ of 190 or whatever the number is. He gets in an accident, his IQ goes to 130. He's still a genius, but he's not that genius.
Yes.
He's got to get paid for the 60.
Yes, that's
he's
right.
impaired,
Yes, right. And disability versus impairment, I find a lot of attorneys don't even understand the difference. And they say, I want an impairment rating. I said, you want a disability rating or an impairment rating? And they freeze. And I said, okay, let me explain to you the difference so that you can then better put this together for the case. And I think once we have that information, AI will be able to come up with those ratings faster and more efficiently based on objective findings, not subjective findings. And that's so important when we go to court. Yeah. We want to be objective in our analysis. Yeah.
I almost feel like you should have a portal for lawyers that it would be really cool. If you captured all your knowledge, right? They can't see the knowledge, but you captured all your knowledge, every patient you've ever treated, all the protocols, all the diagnoses, and then they got to enter an intake form. They got to enter their, I'm giving you I'm an entrepreneur, a business idea. So they enter in all their information and they get a recommend, they pay you $395, $900, $50,000, whatever it is.
Right.
and they get because lawyers, I'm telling you, I talk to lawyers all the time, and there's a huge gap, right? And that's why just listening to you, I can see why this would be fascinating for a lawyer, because just that one little concept, right? Are you talking about impairment or disability?
Mm-hmm.
And they're very different. And so now let's talk about your clinic, right? So you've got this really cool clinic. You're treating folks with TBI. There's got to be other things that you're doing. Functional medicine, guys, integrative medicine, go places that I know firsthand, go places a lot of people don't go, right?
Right.
Where are you going now that others aren't going? Like the crowd's over here and you're over here.
Oh gosh, yeah. I get 3 or 4 calls a day from my colleagues, orthos, neuros, chiros, psychologists, psychiatrists, saying, "Hey Joe, I got this case. I'm stuck. What do I do?" And even my own doctors, I have 5 other doctors and myself work here. Probably 10 or 15 times a day, they come up to me and say, just before I came to this meeting, patients have numbness in his hands and his legs when he wakes up in the morning. I said, okay, what's your blood pressure like? Well, blood pressure is a little high. Okay, what's your digestive system like? Well, I have horrible burping and I have bloating. Okay, you're not breaking your proteins down into amino acids. Amino acids combined with things like B vitamins become neurotransmitters to make the brain work. I said, let's get you on some nitric oxide support. Let's open up the blood vessels. And that'll help bring down your blood pressure as well. And as a side bonus, it'll help brain function and sexual function. Oh,
Yeah.
I met with a group last night. They do full body scans. I won't say their name.
Yep.
Full body scans, and it was four medical doctors leading the group, and it was about 10 medical doctors. I was the only non-medical doctor there.
Yep.
And they all said the same thing. They said, we are so burned out on medicine. We are so frustrated with medicine. And one guy said, I can do an exam and guess. You know what? We're going to send you off for an EKG.
Yeah.
He says, we can do a scan, and it's 1,000,000 times better than any of us could ever do because it is AI. We got the scan, we plug it into AI. What does this mean? Now, let's put together a protocol. And I thought that's really exciting to see that the medical world is coming around and saying, we're pretty limited in what we can do to get the patient well. And so that's where we're seeing AI. So that's where we take it. I love to meet with my fellow practitioners and say, how can we help each other? I have surgeons send me cases all the time saying, Joe, Tim has high blood pressure. Tim doesn't have high blood pressure. I'm making this up. I don't know if you do or not. But
Tim does have high blood pressure.
Okay.
Full disclosure, it's very high blood pressure.
Psychic. So Tim has high blood pressure and Tim needs knee surgery, but we can't get medical clearance on Tim. And this goes for PI cases too all the time. Patient needs surgery. They can't get medical clearance to have the surgery. The case stops. Now what? Nobody's getting settled. Nobody's getting paid. More importantly, the patient isn't getting better. They say, Joe, let's bring down Tim's blood pressure naturally. We do a supplement protocol, nitric oxide, B complex. Maybe it's clogged liver. We get you on some glutathione, some chlorella to clean out the liver. We see if there's a digestive issue. Because the nervous system that controls your digestive system is called the enteric nervous system. It's connected to the peripheral and central nervous system by way of the vagus nerve. So if you're not digesting your food properly, the vagus nerve can irritate the heart and raise the blood pressure.
Wow.
So the blood pressure could be coming because Tim has horrible gas or heartburn. Fix that physically, pull the stomach away from the diaphragm, get him on some digestive enzymes and some probiotics, watch the blood pressure drop naturally. Tim can now have his surgery and we're able to settle that PI case or the workers' comp case, or you just need your knee surgery.
Right.
So that's the direction I'm going in, is actually getting the patient well, not just trying to close the case out.
You piqued my interest.
Want to make an appointment, Tim? We can get you in Tuesday.
True story. So when I was in elective medicine full time, most of my customers were, I shouldn't say most, many were regenerative guys, functional guys, BHRT type people, naturopathic. And I was 267 pounds at the time. And this guy, really cool doctor, he was my customer. We were having lunch and he said, can I just tell you something? And I said, I hope you have ears to hear. He's like, you look awful. Just look awful. And I said, I appreciate that. I'm sitting there in my best, $800 suit, whatever the heck I had on at the time.
Right.
And I'm like, yeah, I don't feel good. I've been traveling a lot. I eat like crap. He's like, long story short, he took the no meds, just a little testosterone and some other things. Mm-hmm. And I'm 212. So, and kept it off. But it was because someone like you,
right,
had the courage to say, hey, man, like you're going down a bad road. And fortunately, I was in a place where I totally agreed with him. I was like, yeah. So I love the work that you're doing. And I will be attending next month the American Academy of Anti-Aging, A4M. So really cool, one of the largest, I used to teach at that, not as a doctor, but as a practice manager guy.
Sure.
And I'm looking forward to it because I always meet folks there who are working on, the latest, greatest developments. And I'd be curious to hear your take on this. There seems to be a movement. Our healthcare system is broke, right? That's
Every doctor agrees. I don't know any doctor who doesn't agree with that statement.
cooked. I don't know what we're going to do. And I see more and more doctors, primary care, family MDs, that type of thing. They're leaving that to pursue more naturopathic. Are you seeing that? And do people reaching out to you saying, hey, there's a better way to do this?
Probably twice a week. I was at a party one time, tall, good-looking guy, funny. I'm saying, oh God, I hate this guy already. Like we became instant friends. And he said, I didn't know who I was. I knew who he was. And I said, what do you do for a living? He says, I save babies' lives. I said, go on. And again, I had no idea who this guy was. He says, I'm the head of pediatric ER at a hospital here in Atlanta. He said, I've been doing it for 30 years. I'm bored out of my mind. I just went and got my MBA. I want to maybe go into real estate. I said, you've been practicing medicine for 30 years, plus your, 12 years of schooling.
Yeah.
And you want to drop out and try to sell houses? He said, we're so tied. We can't do what we need to do. Everything is a cookbook. He says, and it drives me nuts. And then we talked for a while. He says, I want to be you when I grow up, pointing to me. He says, I want to do what you do. I love what you're saying, to think outside the box and actually get the patient well. And right now, you have to have a good brain to do that. AI is going to help all of us put those things together and say, okay, what's going to be the best protocol for this patient?
Exactly.
And, we touched earlier on AI. The insurance companies now are gathering all the information, gathering doctors' notes, putting it in AI and saying, was the care necessary?
Right.
Based on the x-rays, based on the MRI, based on our blood work, whatever, was the care necessary? And many times, I know of several surgeons that have done unnecessary surgery on PI cases just to run up the bill. And if you look at the MRI was normal. Why did you do a fusion? It doesn't make any sense. And well, I wrote in my report, it was a ruptured disc. Well, it wasn't a ruptured disc. So I'm hoping that we can clean up the profession with AI as well and get the scammers out and, close them down, because they're taking business away from the metaphorical me's of the world. The people that really want to get people well, they're taking business away. And then when we try to go settle a case, a PI case or whatever, we got a bad rap. All doctors are scum. Well, no, just the ones you've met,
Right.
Yeah.
Yeah. And I think this is such a cool message because, first of all, I love the space that you're in. Like I said, I've got a clinic myself, although I'm not very good at it. That's another thing. I give you a lot of credit. Well, what happened real quick was, I've been a B2C guy, an entrepreneur for 30 years, right? 3 companies, private equity exits. The last one was pretty good. And I got this false sense of, it's a clinic. I've been teaching people how to do this for 10 years. I'll do one.
It's a different ball game when it's yours, isn't it?
I just got the full disclosure, a letter of intent. We're moving out of the clinic owner side. It was fun. There's just so much to it. And fortunately, we were able to partner with a good functional medicine doctor and who has since left to go become the chief medical officer for a AI company. He wrote a couple books.
Right.
And true story, where I irritated, I wasn't trying. I put some labs into our AI and I said, based on Dr. So-and-so's book, the title of the book, create a 90-day protocol for this patient.
Right.
And he was looking at me and the protocol came out perfect, right?
Wow.
And he said, I don't think I appreciate you're using my book. And this is a real issue. And we'll wind down with this topic. I don't appreciate you using my book to train your AI. And I said, well, I don't have a copy of your book. I've never seen your book. You just told me the title.
Yes.
So
Isn't that crazy?
somehow this ended up in the public domain.
Yeah.
And I said to him, and I was trying to be compassionate. I said, if I can find it
And you can find it, right? Anybody can find it. Yeah.
with 2 clicks, you
Mm-hmm.
know, what's your take on that? Like these people, it's a real thing, right? They've done all this research and education, and now people can get access to their stuff quickly, right? It's almost no copyright.
No, I mean, and how do you improve it? The AI took it, changed the wording around into generic words. So, no, we see it, and it could be good and bad. I mean, I can do all this great stuff and it can steal my ideas, but then it can help other people too. And that's a good doctor is going to be concerned about other people. And that's what's kind of nice. We all win if people get well. So.
Well, that shines through in everything that you've said today. So what's coming up? First of all, what's coming up next for you over the next 6 months? Are you speaking anywhere? Are you, books in the motion? What do you got going on?
Well, I've got 2 books already written. I host a radio show, like I said, based out of Atlanta. I've been on Dr. Oz's show. He's been on my show. So we got a good reputation out there with everyone. And I remember 40 years ago that if you weren't a medical doctor, you were a quack. And there was a big lawsuit. It was Wilkes versus the AMA. The AMA lost because it was a big conspiracy against anyone, health food store owners, nurses even. So in 40 years, I've seen tremendous change in working as a team. And I get all the time. In fact, I was just in Nashville yesterday morning for a big conference, a workers' comp conference, because that's messed up too,
Yeah.
and, people riding the system and getting paid and, you don't want to, and my father was disabled. So if somebody's disabled, they should absolutely positively get all the services they possibly can. If you're riding the system, you should be thrown in jail. That's my feeling because I have a personal connection to that. And I don't know, I was taught not to cheat. But it bothers the heck out of me when I see these scammers. I'm hoping that we can bust all the runners, the ambulance chasers.
Yeah.
They are stealing so much business from the personal injury world. Every day I have a patient call me and say, well, listen, I was called, I left the hospital and they said, go see this lawyer, go see this doctor. That's illegal. That's a felony in Georgia now. Yeah. And I didn't get the treatment I needed and the case settled and I only got a couple of dollars and the lawyer was charging me for everything, toilet paper. I mean, it was crazy what they were charging him for. And then they come to me and say, well, I'm still in pain. What do I do? Did you sign the check off? Yes, I did. Done. So I want to see the business get cleaned up because healthcare is just insane. Like you said, what they're doing and the prices are just insane. And that would be exciting to me. So that's kind of something I'm kind of looking toward doing. And I love expanding what I'm doing, teaching young doctors. I have a lot of doctors come in. Most of them I don't deal with because they're not grown up yet. I said, if you want to do this, this is serious. This is not a game. Well, I was running a little late. My girlfriend was in town. I got hung over last night. I'm done. Go grow up, come back, and I'll help you. So the projects never end. I put together a senior housing protocol because senior housing is, I mean, you and I are going to get old someday, Tim. I've heard that.
Yeah. Maybe with your help, it'll go a little slower.
I'll slow it down for you. But I want to work with senior housing because, I mean, the food they're feeding these people is just horrific. Hospitals, too.
Yeah.
You have a traumatic brain injury, they're giving you gelatin. Gelatin can cause problems with the brain. It releases glutamic acid again. So I got a lot of mission, a lot of projects, and I've been in practice 40 years, and I don't see myself slowing down.
All right. So if we want to direct some folks, what's the website? So doctors that might be interested in getting mentored or personal injury lawyers that want to take a more holistic approach, collaborative approach
Sure.
to this, where would people find you?
drjoe.com, drjoe.com. Couldn't be easier.
I love that.
Yeah. It took me a while to get that name, by the way. I had to buy it, but
you're so on brand as Dr. There are no other Dr. Joes. Besides.
But I'd love to help in any way I can. If you have cases you don't know what to do with, you're stuck, I'm happy to talk to you about the cases, kind of give you some direction and guidance as to how to get the better settlements, because it's a vested interest in you too. And what's interesting, I said, the good attorneys, when I teach seminars, they're in my audience and they're sitting there. Wait a minute, but we're talking about neurophysiology. I know, but I want to learn what you learn because then they can present the case better and put the case together. And if we can get all the doctors' records together, in one place. I'd love to see a portal, like you said, and we can all go look
Yeah.
and say, okay, let's see what they said. Well, wait a minute, I didn't find that. Let me call the doctor and see. Oh, you're right. Happens all the time. I get a radiology report. I call the radiologist. Did you miss this fracture? Oh, yeah, I did. Okay, well, that's going to be big when it comes to the case now. Can you amend your records? Oh, I'll amend it for you. So knowing what,
Good news, AI will catch all that.
and that's what I'm excited about. AI can read an X-ray better than anybody, including a radiologist. So yeah.
That's nice.
But drjoe.com, you know, I'm based in Atlanta, but I'm happy to help anywhere in the country. And if you have any questions, just send it through the website.
Got it. I really appreciate you taking the time, Dr. Joe. I look forward to getting to know you better. We're definitely going to get to know each other better. I've got some cool stuff to show you later. Want to thank our listeners for joining us today. As always, super grateful for everybody's support. Please continue to like and share. And again, we want to thank our sponsor, Faster Outcomes, the ultimate AI platform, legal intelligence platform for lawyers and law firms of all shapes and sizes, and coming soon, healthcare. And my instincts tell me we'll be doing a lot of collaboration with Dr. Joe. So with
Awesome.
that said, have a great week.
Thanks, guys.